Very lovely to have you here.
Thanks, Jason. It's a pleasure.
All right, Sima. Yeah, it's been a while since we've seen you.
It's been a little while, yes.
Okay, of course, working hard as always and doing great things for the community.
Yes, always. You know, WestCare is really excited to be doing these trainings, and thank you again for inviting us over to talk about them. They are free to the public. These capacity building trainings will be the last week of July, the 26th through the 29th. And we'll be doing basic HIV, which is the prerequisite course for those who are getting certified to be HIV testers and counselors. So you need to take this course first. We're also doing women and gender in the Pacific. We're doing board development and grant writing.
Which is always needed out here. There are a lot of people who can avail of that.
Always. We always
specifically relative to healthcare?
And just grant writing in general.
Excellent.
I mean, it doesn't matter your organization, you can certainly avail of the grant writing workshop. Yes.
And a lot of people, I guess, don't know, we'll just diverge on that for a moment. Like,
sure.
There are grants for a great many things out there. If you want to do a photo documentary, if you want to produce a film, if you want to get involved in research and everything. So how does that particular part of the training exercise help?
Well, and also I think that a misconception is only the federal government gives grants, but there are actually a great number of private foundations out there who award money to many different projects, not just the federal government. So hopefully in that workshop will help you try to find the resources for your organization.
Okay, and why were these specific topics selected for this particular training event?
I think grant writing and board development are always needed in Guam. There's lots of boards on Guam, and boards change, board members change, they go on and off boards, or they change organizations. So it's always nice to, and even if you've been a board member for a long time, it's nice to know the new regulations and new information. It's always nice to keep up to date. Women and gender in the Pacific, and particularly women and gender and families from a Pacific perspective, is really in line with our grant, because this series is funded by a grant by the Office on Women's Health under the U.S. Department of Health and Human Services. And I think that we always need to explore that aspect of who we are as a community in relation to women and children and families. So that's always a good and riveting topic for those of us, especially in social work and human services. It's always interesting. We're a matrilineal, matriarchal society, so it's always nice to go back to that and see the research that's been done.
Okay. Well, of course, in our capacity as a news agency, we'll be covering it, of course. But for people who would like to avail of the training, how can they contact you guys?
They can call WestCare Pacific Islands at 472-0219. They can also email me at Kate, K-A-T-E, .Baltazar, that's B-A-L-T-A-Z-A-R, at westcare.com.
Okay. And if I could just maybe ask you to maybe look into the crystal ball, because you are, of course, the all-knowing person. What are maybe some of the topics that you foresee maybe coming up in like future training events, maybe either based on need or like what you guys would be interested in talking about?
A lot of what we're going to be doing has to do with youth, and and a lot of things relative to socioeconomic development, teaching people to be more self-sufficient. A lot of people that we're finding are not employable in the regular 9-to-5 kind of model of employment. And so that's not to say that they can't be self-sufficient in other entrepreneurial ways. So that's something that's coming up as well.
Okay, well, obviously it goes without saying that, keep up the hard work. And
thank you.
Very, very appreciative
of all the things
that you do.
Thank you, Jason.
Okay, thank you so much for the information.
Great.